The lack of clarity on how the virus is spreading and the lower rate of deaths versus international estimates adds only to the intense speculation on the actual situation in China. Minmin tells us more.
70-year-old Wang Fugang lost his mother unexpectedly to COVID-19 at the start of the new year. She died at the hospital, where her body still lies in the morgue. Mr. Wang is still waiting for authorities to inform him when the body would be cremated and when he could collect the ashes.
由市政府另行安排，可花的时间是你等通知90天，什么时候电话通知你，那么你就到什么地方去领骨灰。大礼仪这是没有了。
Mr. Wang says he finds it difficult to accept that he can't give his mother a proper send-off, but he found solace after realizing others experienced worse.
有的家属病床难久了以后，就死在家里了，已经甚至于差不多在多天了，都还没办法顺顺利利的把这个接到殡仪馆，把尸体接走。
Mr. Wang's mother is one of nearly 60,000 who died in hospitals during this latest COVID wave. For the first time since the pandemic began, China released a COVID death count that includes those dying from other underlying diseases besides respiratory failure. This after widespread criticism for its narrow definition of COVID deaths. But experts say the latest data still underrepresents the severity of the outbreak.
If you divided this 60,000 by the number of hospitals that treat those cases. So each week, there's average only one patient die. That seems to be not consistent with, the anecdotal evidence.
CNA visited and called several crematoriums and found that some places only offered a 10-minute send-off ceremony, others none at all. Many faced waiting times lasting months.
现在这里可以进行遗体告别仪式吗？
目前没有，是立即火化。
立即火化，所以家属不能办丧事是吗？
对，没有仪式，没有这道仪式。
Funeral service was in such shortage that the government began cracking down on funeral scalpers who charged exorbitant prices during this dire straits. CNA understands that funeral agencies are no longer allowed to offer intermediary services. Customers can only liaise directly with mortuaries now to avoid overpaying.
I visited several shops selling funeral supplies, and some told me that business has gone up threefold and prices have doubled. Yet some say they're stuck with stock that they can't sell because people are not able to hold funerals.
鲜花也卖不掉，
卖不掉，谁呀？追悼会都不开卖什么鲜花？
原材料没有了，好多都没货了。你像这些盒子，你看到的都不一定有货的，很多都断货了。这一枪死的太多了，没办法。
The revised death count doesn't include those who died outside hospitals, like in elder care facilities or at home.
So can we talk about the countryside, right? Where there's a lack of access to antigen tested kits, so it is very likely many of those patients died at home, without even getting tested for COVID.
Experts estimate that China could see over 1 million deaths this year. Over 90% of those who died so far are 65 years old and above. Authorities believe the peak is over in large cities like Beijing and Shanghai. But China is now bracing for another peak to hit the rural areas as Chinese New Year approaches, when millions of migrants head home. Minmin, CNA, Shanghai.